Hello, everyone. Welcome to CIO Leadership Live. I am Kirat Attar, Content Strategist at Foundry, and I will be your host for this episode. Our guest today is Bhupendra Solanki, Chief Information Officer of Sakra World Hospital. Bhupendra, thank you so much for joining us for this episode of CIO Leadership Live. It is a pleasure to have you with us.
uh, to be the possibility to bring my thought idea into the one renowned platform like Foundry, now part of IDV. Uh, it's a pleasure to be here with you, and then hope I'll answer your questions, which is pertinent towards the this IT journey of the healthcare industry. So I'm hoping that. So let me introduce myself. So I'm working for Sakra World Hospital as a CIO of past 5 years, and
Mhm.
then I have around 2 decade experience in healthcare IT, especially. So Sakra now 1 decade has completed and entering to the second decade. And Sakra is a single hospital. It's a first FDI hospital in India, situated in Bangalore, India. February 2014, it's made go live.
Mhm.
Thereafter, serving the even more than 7 lakh patients across the vicinity.
All right.
Now Sakra is adding the two more entity and then adding the around 1,000 bed into their clinical care pathway. So that are green field projects. So maybe will take time 3 to 4 years, but definitely we'll have more vicinity within a Bangalore and thereafter outside the Bangalore as well. So this is our roadmap as a part of Sakra digital healthcare journey.
Thank you so much, sir, for introducing Sakra's tenure in India and the digital healthcare space. Hopefully, over the course of this conversation, we will be able to get into all the different aspects of how healthcare is being taken to the next level at, the first Japanese hospital in India.
Yeah.
As we have, we're 4 months into 2024, the first quarter is done. A lot of different technology trends have come around and they are revolutionizing the space. What significant technological trends do you see emerging as game changers in the IT space in healthcare, which is a very novel, unique space, whether it is in cybersecurity or in endpoint protection or in medical devices or any other noteworthy technology, according to you?
Like I seen 2 decade experience in healthcare. So the transformation which I seen here, like floppy to cloud storage, kind of those
Yeah.
transformation we see. Uh, Till now, even post COVID, things got changed and everybody noticed. But before COVID, the technologies are bare minimum in healthcare. Correct. So
True.
to run the show, just we are running the technology.
Yeah.
But during the COVID, the technology shows their strength, and
Yeah.
then everybody recognized and revolutionary to the patient care transformation. Earlier thinking was patient has to come to hospital. Now healthcare is thinking healthcare has to go to
So the
patient,
patient.
patient home
Yes.
or patient wherever patient is there. So with that thinking got changed. This change came with the help of technology. If
True.
technology is not there, you can't reach to the patient. Correct?
Yes.
So that emerging technologies are there. Like we talk about Sakra. Sakra is replacing their HIS into a smart solution. Correct?
Okay.
Where till now the HIS works like a dummy solution. Whatever you are feeding, it is keeping with it. It is not throwing the notification, not taking to you the next screen like
Okay.
that. So this now new solution, it's emerging only because recent team just 4 5 ago they developed, and then we feel it's a better for the healthcare which have to get the better outcome.
Yes.
So smart HIS solution which helping to the navigate the user to next screen, means once they finish this screen, it will show the next screen. So that will
Automatically.
automatically.
All
So
right.
that will help the user to complete the task very minimum period, and an error of the chances will be very less. Second, like escalations. the HIS which having in across the healthcare industry don't have the escalation, even notification things. So escalation help you to revert on the missing task immediately, means not attended task. Like nurse forgot to give the medication, correct? Doctor prescribe morning, afternoon, evening. So afternoon medication, nurse forgot to give the medication.
Yeah.
And system predefined time system alert the TL, means nurse head. And then if nurse head also not responding within the stipulated time, then chief of nursing will be notified by the system. So that kind of escalation we are bringing in it. Second, notification and reminder also. So this smart solution we are getting with the help of technology, which will help the patient care in very vast area, we can say, where the clinical outcome will be more precise and better.
So the escalation matrix is when the patient is in the hospital ecosystem, or is it when home healthcare?
Both. If patient in the whole healthcare ecosystem, yes, definitely it is there, and home healthcare as well. So home healthcare, even periodical notification also there. Means you done your health check last year, this year you are missing. So if you are don't want to miss, please visit us or nearby hospital like that.
Correct.
So such kind of notification escalation we are building in our system.
I think that's a very important technology, because especially for maybe patients who are older or unsupported, they would need somebody to maybe remind them. So the hospital can take care of that. Then that reduces also maybe the burden of care on their family and friends to make sure that they are following up on their healthcare checks, which I think is very revolutionary. True. So moving on from emerging technology to the technology that seems to already be incorporated in the Sakra ecosystem, that is robotic technology. I had the opportunity of checking your website, and you're clearly making great revolutionary strides in incorporating robotic technology, which is cutting edge, and it's benefiting patients in various ways, like shorter hospital stays, etc. So, as the CIO of Sakra World Hospital, can you tell us more about how you've incorporated robotics in healthcare, and what does the future look like in that space?
And as we said, 10 years ago, we started our journey. So that time, being a Japanese management and Indo-Japanese culture, that time only we brought the latest and cutting edge technology. You can say 3 Tesla. That time, I think 2014, in India, healthcare, it was not there. 3 Tesla means precise image will come, so doctor can identify more accurate the disease. So that way. So in 2014, we brought that technology. And apart from that, during our journey, we we entered so many robotics, like rehab we are using robotic, ortho surgery we are using robotic, neuro we are using robotic. So robotic, as we said, it's a Indo-Japanese collaboration. So this robot is helping to do the precise clinical care. Correct. It is not like that. It was not happening earlier. It was happening earlier also by man-made. But now man hand is more precise to do these surgeries, to do their rehabilitation support, all those systems. So that technology, no doubt, helping a lot. And then the Japanese culture or Japanese management always take care the quality of care. Absolutely. They don't focus on the quantity of care. They focus on the quality of care. So quantity will come automatically if we are providing the quality of care. So that is our motto, to achieve the best quality care in the healthcare industry in India. And then sometimes these Japanese allow us to go Japan to see their system in medical system, and then sometimes they come to have the look in Indian healthcare system. So both way. So that is a both way communication on the technology part, on the clinical care part, on the medical technology part, all aspect. Have you seen any change in the way your patients of the hospital have responded to robotic care? Was there some apprehension, or were they always on board? What has the response been like? Yes, response is very good. Very, very good because it's a we can say electronics city of India, correct?
It is
Electronic.
true.
So people are more technology savvy. They know the strength of technology. They know the outcome of the technology. Even they only developing those softwares and this technology thing to across globe. So
Yeah.
so they prefer this robotic surgeries more in terms of non-robotic surgeries.
Yeah.
And one more help we are getting this insurance company also covering robotic surgery into their insurance plan. Earlier, initially it was not there, so people little bit scared to go to the robotic surgery because it's a part of their insurance package. So that is
Okay.
fine. But now, with the help of government, it is taken care by the insurance company as well. So, due to that preciseness and better clinical outcome, people are preferring robotic surgeries, and then it's a very minimal invasive this surgery happening through the robotic means less blood loss kind of
True.
or less cut off in your body. It is there, so that helping to recover instead of 8 days, 5 days only. So that
Oh,
so in that manner also it is helping that robotic surgery.
thank you so much, sir. Truly, it is a very exciting time in healthcare because the faith that a person has in a doctor, if that can only be multiplied through uh, valuable and appropriate technological aid, can only make the lives of the patients better, especially those who are probably battling more complicated diseases or have more complicated surgeries performed on them. So I think of all the data that is generated in the world today, because we also have transaction data in shopping centers and from online shopping, and healthcare Fitbit data, which is generated from our smartphones. So there's a huge amount of personal individual data that's generated in the world today. But healthcare data is probably the one that requires the greatest accuracy during collection. Because if the numbers are fuzzy around someone's blood pressure or sugar, etc., that could be potentially life threatening, as well as the fact that privacy is required when we're talking about someone's sensitive medical data. So, how does Sakra World Hospital and you, as the CIO, utilize cloud and data security to safeguard these aforementioned aspects when it comes to patient privacy as well as their healthcare integrity?
Yes. In healthcare industry, NABH, there is a standard organization who take care the standard in healthcare fraternity.
Yeah.
So we got NABH, National Accreditation Board of Healthcare. So that always give the preference the data privacy and data security both. So they have two norms for IT specifically. They always do the audit, and then we have to be more cautious on that part. Now coming back to this data. So earlier also data coming, but not 100%.
Yeah.
In the form of like lab reports or radiology report or EMR. Now it's in trend.
Yeah.
Earlier it was not much.
Not
It was on paper. So that way. So as we talk about Sakra, so Sakra coming up with the data lake. Three type of data is there. One is patient or clinical data. One is employee data, and third one is vendor data. So we made three bucket for all three type of data. Patient or clinical data we are utilizing for their betterment. Okay,
Yeah.
for research purpose. That way, earlier it was not happening because we don't have a common bucket. Even if you have a data lake, so you can more keep the more security on that data lake because it's a single bucket, not on the bit and pieces. If it is in bit and pieces, then you have to make the whole framework for the data security or cyber security, you can say. And that data lake will help you to plug in any BI tool to pull out the uh, required information in the patient care journey, and we can notify them like this pregnancy journey, 9-month journey is there. If we have that data from the patient. Even we enabled that information on our app. The pregnant lady can feed their symptoms, their whatever vitals into our mobile app then and there from the home. And when she coming back to the hospital to show their doctor, that time doctor can see all those notification means feeding data
Yes.
by the patient.
Right.
Means when baby did the kick, or some fever was high or cough was there, all those things can see, and then doctor can provide the better care. In most of the cases when you are in front of doctor, you forget the things, means from you are
True.
coming to the
True.
home from to the doctor, that time you said I'll speak, I'll ask this question, I'll ask this question, that question.
Yes.
But when in front of doctor, you forget, I think more than 50-60% thing. But here you record it then and there, and doctor can see all those things. So that helps to provide you better clinical care. So all those things are there. And healthcare being a data security, privacy, as well as the heavy file size, means if you talk about CT, X-rays, ultrasound image, it's in GB. So GB file size, upload to the cloud and downloading to the cloud, real-time reporting, much difficult. So healthcare keep two environment, one few application on cloud and main application on the on-prem or private clouds. So that way they are managing their show. We also doing same thing, and then doctor can do the reporting promptly. With this in-house or on-prem data, they can open in a click. If you go to cloud and pulling your data, then rolling, because it is not like the compute power not available on the cloud. Yes, compute power is there, but the connectivity from cloud to your organization, that is a challenge. So due to that, that limitation comes in the imaging solution side. So for that, we in the combination of hybrid cloud, means private and public, plus data lake also we generated to serve our patient or to give the reminders to them. Yes, that is their choice. They want to come or not. That is up to them. But our responsibility, being a primary healthcare provider to them, we have to make sure that they should be notified at least.
So that's absolutely true, sir, because I think from your part, the due diligence is to inform them of when they are required to do the checkup. The rest is, depends on the patient's adherence to their treatment. That's very true. So shifting a little bit from, Sakra's technological and medical journey to your journey, as a CIO, you play a very pivotal role in driving digital innovation, all along and especially today in your organization. Do you have a sense or a perspective on what the future of IT will look like within the healthcare industry, and how Sakra World Hospital is preparing to adapt to these upcoming technological trends, challenges, and opportunities?
As we said earlier, future is with IT. Okay. Any organization, it is not like healthcare only. Any organization, future is with IT. So with the help of IT, we can reach to patient at their doorstep. Now it is difficult to, because in one healthcare, if you are setting up one hospital, this cost goes to the in crores, correct? Like 350 bedded hospital sometimes reach to 400-500 crore cost. That cost will become costly the treatment, correct?
Absolutely.
So with the help of technology, we will reach to the patient, we'll serve the patient then and there, because more around 100 patient, if I count 100 patient, out of 100 patient, 10 need or 20 need hospitalization. Rest we can treat at their home.
Yes.
So both way, patient also will have the economical treatment at their doorstep, as well as hospital will treat the really needed patient or surgical patients only, or chronic diseases patient only. So that way both will be in win-win situation in terms of clinical care, in terms of commercial efforts, we can say.
Cost effectiveness also.
Cost effectiveness. So now CIO role, it is not up to the bringing the technology. Earlier it is like that only. Means
Yeah.
new solution came in the market. Sir, can we buy it?
Incorporate it, yeah.
Can we incorporate into our system? Okay, if you get the approval, then you are incorporating. Otherwise, no. So no business linkage. Correct.
Yeah.
Now management also seeking that business linkage of each solution. Like we said, we are implementing smart HIS solution. So smart HIS solution, what going to deliver in terms of business or in terms of clinical outcome?
Yeah.
So those parameters also added into CIO role. Earlier only technology, latest technology should happen and then the new features. But I really we need those features for the clinical care. So those alignment now part of CIO role.
Yes.
And so and one more thing, every has hospital or healthcare looking for virtual care. That is the future for the healthcare industry. And also because if you see, I think in 1,000 people, one doctor is there. So how we can manage how we can reduce that ratio? So that ratio we can reduce by virtual care.
Yeah, that's true. That's true. Virtual care will allow you to take healthcare to more and more people, especially if situations like COVID become a more frequent thing where people cannot leave their houses, but in fact, pertinent healthcare is the need of the minute, if not the hour. So that's very true. So my final question to you is a little bit more related to your leadership, over technology, because like you mentioned, you have 20 years of experience and 4 years at Sakra World Hospital. So if you had to share your leadership principles for your fellow tech leaders and peers in the technology domain, or to somebody who would want to have, this sort of career in technology, what are three significant tips or advice would you impart to them so that they're able to follow in your footsteps, so to speak?
Yeah, definitely. But yes, every CIO have their own vision and own technical strengths. But still, I would request one thing, means your decisions should be in line with the business. First, identify your business processes in your organization. Like sometimes CIO from the one industry to switching to another industry. So you have to leave all those things in previous industry, and then new industry understand the understand the new industry strength or processes, so that your decision on the technology part should not be wrong or not completely accurate, we can say. So, as a first step, whenever you are taking or bringing new solution into the organization, then BRD should happen closely with the users. BRD we call business requirement document. If
Business
that is,
requirement.
if that is happening on the micro level, then the chance of failure of the solution or adaptability of that solution will be, I think, 0.001%, because you've taken the input from the end user, whatever they want or whatever they are doing manually as of now, or some part of in system that you are bringing in the system. So BRD should be closely with the user, end user, and then identify the things like what are the needs, what are the wish list. So divide into two segment. Need, you need a from day one. Wish list you can bring in future or in phase 2 or phase 3, like that. So those things need to take care whenever as a CIO you are taking decision to bring the new technology, new solution into the organization. Then you will be a successful CIO in most of the cases, because successful CIO, it's not like you implemented successfully that new application. No, it should be aligned with the business, and an outcome should be there in terms of whenever we decide for the solution, and then we see, okay, it will serve up to this patient, and then clinical outcome will be better. So all those objective parameters should achieve through that solution.
That's very true. That is absolutely true. Sir, thank you so much for your very candid discussion with me on how technology has been augmenting healthcare. I think even from the perspective of an Indian, Japanese technology is something that we look up to as being uh, the fastest ahead of us when it comes to the sophistication, the precision, and the accuracy. And to have something like that incorporated in healthcare for to improve the lives of people, to give people that fighting chance, is something that inspires confidence in people. And when that is combined with the single-minded devotion that healthcare should be available to all, and that it should be cost effective, and it should be easily accessible, I think that is something that makes people realize that this is a good thing for them.
One thing I want to add here, being a Japanese management, they always ask, like, why it is not happen. So that factor make us to do the things, correct?
Yeah.
So if they approve any technology, they always ask why it is not happen. Uh, so that is the motivational factor to bring the new technology in line with the business.
Absolutely. Absolutely. I wish you all the best for the future and to incorporate a better and more patient-friendly technology, and that Sakra World Hospital achieves its mission of taking healthcare, quality healthcare to every citizen, I hope, in Bangalore City and across India. This has been a tremendous conversation. Thank you so much, Bhupendra.
Yeah, thank you. Thank you, Kirat. Same here. Thank you.
Thank you so much. And to all our viewers, thank you so much for watching. This brings me to the end of this episode of CIO Leadership Live. Until next time, this is Kirat signing off.